This is Pat Salber with Health Innovation TV, broadcasting from Health Datapalooza, and I'm actually wearing two hats, one as an interviewer and one as a partner to these guys, and we're going to tell you about a pretty exciting project that we've been up to. And I think I'm going to start with you, Adam. I've come to know you as the challenge guy. Could you tell us a little bit about what that means? This is Adam Wong from the Office of the National Coordinator.
Sure. Oh, sorry. It's been a long day. I'm Adam Wong. I'm the program manager for the Prize Challenge contract at ONC. We are really excited about this new challenge, the Blue Button Co-Design Challenge.
We have to stop here and just do this. This is the Blue Button, guys.
This is a great time to be doing this challenge because I think we're at an inflection point for Blue Button Plus.
Can you say a few words about what Blue Button is in case somebody doesn't know?
Blue Button is a way for all patients to download their data, and Blue Button Plus is kind of the set of protocols that allows individuals to share that data with third-party providers and integrate it into apps and other applications, and just be able to take more charge of their data.
Well, that's pretty cool. And so what are you going to do in this challenge?
Well, this challenge is composed of two sections. There is a open source developer tools challenge, or a segment that we... My brain is totally fried.
No problem. Rewind. Listen, I can't even talk. What's your name again? No.
So this challenge has two parts. The first is the open source developer tools segment, in which we're asking developers to create tools that will allow the easy implementation of Blue Button Plus into new applications and new forms. The other is the patient applications part, which is really exciting because we are integrating the kind of ideation crowdsourcing at the beginning of the challenge. We're asking people to submit their ideas for how they want to be able to use their data in applications, and we're going to take those best ideas and select the best few, and then have the challenge reflect what those ideas are. So we're going to want developers to create applications based around these best ideas. And then at the end, we're going to bring the public back in for a public voting process in which public votes will count for 1/3 of the review criteria.
So I think this is really interesting. The end goal is that you want to develop tools for patients, and you're actually asking patients what their ideas are, and you're asking them to help design it, and then you're asking them to help pick the winner. I mean, that's pretty amazing.
Crazy,
so
very
crazy. Rebecca, are you behind all of this? Why is this crazy thing happening?
Not just me, it's definitely an effort.
I'm sorry, introduce yourself.
Sure. I'm Rebecca Mitchell-Coelius. I'm the Medical Officer for Innovation in the same office as Adam, the Division of Science and Innovation. My role there is to lead in strategy development and new program development. I think the Patient Co-Design Challenge really came out of this sense that we're building an ecosystem here, and we've been reaching out a lot to the developer community, the data holder community, and to patient advocates, and we were asking them, what are we building and why? But there'd been no real public platform upon which patients could really come out and say specifically, this is why I need the data and this is what I would use it for. And got really interested in the whole idea of crowdsourcing and crowdfunding, both through your company, Pat, which I hope we'll talk about in a few minutes, and then also through going and judging at the New York eHealth Collaborative Patient Portal Design Challenge that they had recently. Just a very special way of democratizing this challenge process, and I think lifting up the patient voice across the country and saying, developers, this is what people really want, and they want it now. And my hope is they're not just telling us, but they're also thinking about it and bringing that message back to their providers, because at the end of the day, it's really going to be a lot of the physicians out there going to their EHRs and such and saying, we need to build this capability within the EHR and we need to do it well because patients want it for purposes that I care about as a physician.
So it's pretty exciting. We both trained in medicine at the same institution, but a few years apart. And I trained in the era when, the physician was king. Actually, I was one of the early queens. But things have changed a lot, and so much more for the better, because this whole Health Datapalooza and the whole exciting innovation and startup community is all about engaging patients in the patient empowerment movement and the Society for Participatory Medicine, all these other exciting things. So to have ONC, design a challenge where, and I want to go back and just emphasize what you said, there's going to be crowdsourcing of ideas. There's going to be patient co-design where the patients will come in, actually on my platform, healthtechhatch.com. You knew I'd have to get that in. And they're going to iterate with the developers and tell them, you really shouldn't do it that way, because if you do it that way, I'm not going to use it. And if you do it that way, I may use it. And then it's really cool that the patients are actually going to have a voice in saying who's the winner of all of this. So I have to applaud you, because I think this is the first time that I'm aware of that this kind of incredible engagement of patients from the very beginning, the generation of ideas, to the very end, picking the winners, has happened. So how'd you think this up?
Well, I think that in previous challenges, we've had a challenge of trying to incorporate consumer feedback, and we've tried to devise other measures to serve as a proxy for consumer interest. This time, we're actually just going direct to them, which kind of makes sense, I think. And I just want to plug the crowdsourcing process. Go to the ideas.healthtechhatch.com site and submit your ideas now until this Friday, the 7th. And you can also go to that site and vote for your favorite idea through next Tuesday, June 11th.
And I just want to give you a little update. We posted the project on the site. It went live yesterday at 3 o'clock. There's been almost 500 visitors to the site since then, and there are close to 100 active users of the site, and there's already 30 ideas, and some of the ideas are really pretty cool. My favorite one is make pharmacy stink less.
That might be a little bit out of our control, but I definitely agree.
Well, you can do anything with data, right?
Exactly.
And where do you see things going from here with respect to this whole idea of engaging crowds and engaging patients?
Mm-hmm. I mean, I'd like to see this thread running throughout all of our challenges, to be quite honest. And whether it's patients because it's a consumer application, whether it's a provider application, I think we need to do more to bring in the end user into our challenges on judging panels, whether it's defining what we build around in the first place or judging it at the end. In terms of Blue Button itself, this is really just the beginning. I mean, Blue Button Plus as a standard for secure, patient-owned the transmission process is really new in the past year. And we're really hoping as part of this challenge, it's not just about engaging the patient community, even though that's obviously a huge piece of it. It's also about engaging a lot of those developers out there to come in and really play with the standard and understand what is a consolidated CDA, what is direct, how difficult is it to really participate in a trust bundle. And we both need that feedback. And we want them to also build those open source tools for each other so that in the future it'll be even easier for future applications to be built.
Okay, so I can't let you get away with saying a really cool phrase like trust bundle without asking you what on earth is a trust bundle?
I am not the technical member of the team, so I'm just saying.
Good, Adam. What's a trust?
So for technical questions around the actual implementation of Blue Button Plus, they've built a wonderful implementation guide at bluebuttonplus.org that walks through all these different steps. But at a high level, the trust bundle is really how the data holder, the provider, the electronic health record, knows that the application that the patient wants to send the data to is a good actor within the community. And each of those applications will have to become part of a trust bundle to participate. So it's saying that patients have the right to send their data wherever they want to send their data, but there is a small piece to it saying we're going to ensure that there aren't companies out there, lying to patients' faces. And it's the community itself of applications, not us as government, that are going to define.
Make sure there isn't some bad actor out there who might, run away with your data or turn it into some kind of bad malinformation or something along that line.
That would definitely not be ideal, and it is not the intention. But our position on it is that it's really about a patient's right to use their data as they see fit. And I think the trust bundles themselves. Again, I would really encourage people to go to the implementation guide to look at the specifics and to become part of the community to help it evolve and have their voice heard and with how the trust bundles should work and really where the bar should be.
So we've talked about the developer and we've talked about the patient, and you have all this great data that used to be owned by the doctors. Where are the doctors in this whole thing?
Where are the doctors in this whole thing? There are actually a lot of physicians out there that are incredibly supportive They really believe in the idea of patient engagement. A lot of them really do believe in the idea of patients having access to their data, and I think are increasingly becoming convinced, like the couple studies that came out in the last year showing that you can give patients access to their data, and it's not going to cause your office, to be overflowing if you lose all of your patients, a lot of the common fears that providers have. So I think the tides are turning. I would say that a lot of providers probably aren't aware what a huge role they can play in this. Again, they need to go to their electronic health record vendor and say, this is really important. I do want my patients to have access to their data so they can manage their medication list. They can manage, their family's health history in one place. This is important to me. So let's build this interface within the EHR in a way that, patients, not all patients are particularly tech literate. People should be able to go in and send their data, and just as they can go and use an ATM, in most towns in this country, and the average person can do that. It's easy to navigate. That would really be our ask and our hope of the provider community right now, and that they're also educating their patients when they're coming into clinic that this capability now exists.
And do you see some of these apps being the kind of thing, I'm going to put a patient hat on now, that I could use, that I would end up getting my data in a way that would help me communicate with my physician? Or is this really just stuff that I'm going to, do it yourself medicine, I'm going to do it at home?
I think the sky is the limit. I think we